name is Sandra Leal, and as chair of the 2023-2024 APHA Committee on Nominations, I have the honor to serve as your host for today. You'll hear from 6 amazing candidates this afternoon to guide your vote for APHA's future leadership. This virtual event is all about getting to know the amazing candidates who have volunteered their time and energy to serve you as part of the APHA Board of Trustees. This year's election also features nominees for the APHA, APPM, and APHA, APRS academic leaders, special interest group leaders, and some proposed changes to the APHA bylaws. But tonight, the spotlight shines on the Board of Trustee candidates. Let's give them a roaring virtual round of applause by typing the location you are joining us from. All right, and I see people from all over the country here. I see some people from Florida, some people from Arizona, including myself, Virginia, Phoenix, Hawaii, that's great, and Georgia. I'm so glad you can join us today. So here's what we have planned for the next hour. We'll first get to know each candidate with a quick introduction from them. So we'll meet the candidates, and then you can unleash your burning questions in the chat or raise your hand to be called on to share your question out loud. We'll have 2 rounds of questions for the candidates to respond. And then we'll hear some final words from each of the candidates. And at that point, you should feel like an informed voter. So we do have some ground rules. Before we jump into the candidate spotlight, let's establish what those are to keep things smooth sailing. First thing, we really appreciate if you can mute your mic so that we don't hear any background noise. We want to make sure we're hearing the candidates loud and clear. Please feel free to raise your hands to be called on or share your questions in the live chat box to the group. Alternatively, just read the questions out loud, or you can type anything that you have questions about. Regarding timing, in the interest of time to hear from all the candidates and to allow the candidates to answer as many questions as possible, keep your questions as brief and straight to the point as possible. And if we get an abundance of questions submitted, then we will have the candidates respond to these via the APHA Engage platform following the session. Also, please direct your questions to the candidates. You can direct your questions to either the president-elect candidates or the trustees at large candidates, and all candidates of that respective category will have the opportunity to answer your questions. Keep in mind, with limited time, we will ensure that each group of candidates has time to respond to the same number of questions each. Also, please introduce yourself. Just let us know your first name and last name and the city and state where you practice pharmacy when you ask the question. Respect is key. Let's all be professional and courteous during this process. Finally, take note of our APHA antitrust policy and let's all adhere to it. We'll post it here. I'll give you a few minutes to read through that. All right. So now let's go ahead and get started. Each candidate will have 1 minute to share a bit about themselves, their vision for the association, and their key plan if elected. So we have about a minute each, and I am going to start by calling out the president-elect candidates, then the candidates for trustee at large, 1 and 2, and then we will begin by starting with the first presidential-elect candidate, Vibhuti Arya. Vibhuti?
Thank you so much, Sandra. Hi, everybody. I'm a little bit under the weather, so I apologize for my voice being subdued a little bit. I'm Vibhuti. I'm a public health pharmacist. I work primarily with the New York City Health Department, working towards policy, program development, and workforce development. I work with independent pharmacies to build a public health presence in New York City. And essentially, I pioneered this position about 15 years ago and have been able to do some really fun stuff. If anybody has any questions about correctional health and or detailing, public health sort of work and really looking at multi-stakeholder engagement. So primarily, as I said, I work with lots of different kinds of stakeholders who seem to have their own agenda. Everything from the mayor's office to independent pharmacies to community-based organizations. But among what I bring to APHA is my understanding of the association for over 20 years, working in this multi-stakeholder space, and also an infectious enthusiasm for pharmacy. My enthusiasm, however, is not blind to the very real things that we are experiencing in our profession today. And so I am really important, and what's really important to me is looking at accountability. And one of my favorite questions to ask is, should we find ourselves here again, what could we do differently? And so I'm going to stop there. The beauty is my name, accountability is my game.
Thank you so much, Beauty. Nice to see you today. Our next president-elect candidate is Magali Rodriguez de Bittner, and I'll pass it over to you, Magali.
Yeah, good afternoon, everyone. Buenas tardes. I am so delighted to be here with you today to talk a little bit about me and also why I wanted to run for president of APhA. I am a faculty member at the University of Maryland School of Pharmacy, and I'm also a past APhA board member. I have served in the APhA board for 6 years. I also serve in the APhA Foundation as a member and also past president. And currently, I am a practitioner. So I work in physician practices and really in value-based care. I have dedicated my career to advancing pharmacy and innovative services and really trying to find ways for us to get paid for our services. More recently, I'm working in Maryland to institute a Maryland payment parity law. So we're working to get pharmacists in the state paid for the services that we provide. My platform that I bring to you is really claim your profession. I understand, and as a practitioner, I see the challenges that we face every day with payment reforms, with other things, but I really think I want to bring optimism and hope. I think that the better days for pharmacy are ahead of us, and I think we have a great opportunity to really develop practices that haven't been developed yet. So I really want your voice to be heard at the table. I always have pride myself at the board table of speaking and bringing the voice of our members and really advocating for diverse patients and really meeting the needs of our underserved patients. I think we have great opportunities ahead of us as well as challenges, but I think APhA is poised to really help. I'm very proud of some of the things we've been doing more recently with really being bold and courageous and calling the issues on pharmacy that need to be called. And I would love nothing more than continue to serve you in that capacity and continue to move APhA forward and have your voice being heard.
Thank you, Magali. I appreciate the two presidential elected candidates on their introduction. We're going to go to Board of Trustee at large, pair one. So we'll start with Kelsey Aragon. Kelsey?
Hi, my name's Kelsey She, Hers. I'm a pharmacist clinician and assistant professor at the UNM College of Pharmacy. And so as a pharmacist clinician, I have prescriptive authority, advanced practice, and I'm fortunate enough to serve gender expansive people where I provide gender affirming care, and I provide cardiovascular risk reduction services for people who are living with HIV. I love what I get to wake up and do every single day. And so my goal and some of my background is I'm also a community-based pharmacy residency trained with UNC and Walgreens. I've worked at Walgreens from 2011. It's so strange to say worked. I actually stopped moonlighting at Walgreens, so I continued to work at Walgreens up until last April, when I was starting to get pretty pregnant with my second child, and it just wasn't as feasible for me to continue to pick up shifts at Walgreens, and I wasn't going to have the leave for my maternity leave after. I miss it, but I still teach our self-care course, and I love community-based pharmacy, and I still consider myself a community-based pharmacist in the ambulatory care setting. What I plan to bring, I've also been very involved as a student pharmacist, as well as a new practitioner, both in the new practitioner advisory committee and all of those different groups, as well as in the SIGs. And so what I hope to bring is, I hope to be someone who leaves breadcrumbs, as our keynote speaker at APhA said. I want to bring up people's names in the board table that maybe haven't had a seat or been involved at the board table before. And as we potentially have bylaws changes, I think it's going to take individuals that have a really good understanding and advocacy for both student and new practitioners and early career practitioners on how do we keep them engaged? How do we keep them involved as members? Because as new practitioners, I myself am a mom, and it is an intentionality to show up and to continue to stay involved. And I want to make sure that those voices are being heard, because that is a big part of our profession, are people in the workforce having career transitions. And so their voices need to be heard, and they need to make sure that they're being kept in mind as we move forward, as we progress practice. And as APHA stands as the home for all pharmacy, I want to make sure that we stay true to that. Thank you.
Thank you. I know we're a little passionate here. If we could try to stay to about a minute, that would be great, just so we have time for questions for everybody, but don't want to cut anybody off. So appreciate the introduction, Kelsey. Next is Scott Tomerlin for the Go ahead, Scott.
Hey, good afternoon, everyone. My name is Scott Pomerlin. I'm a community-based pharmacist in the chain sector from Melbourne, Florida. I'm also married to my wonderful wife of 18 years, Teresa. She's an independent community-based pharmacist here in Melbourne. We together have 3 beautiful children. I've had the privilege of serving the past 18 years as a career in the pharmacy field as pharmacist. The first 17 years we're serving in the front line as a pharmacist and pharmacy manager at Walgreens, up until the past year, where I now serve as a manager for pharmacy affairs for Walgreens. I know firsthand the community-based pharmacy practice that I love so much is hurting, especially the chain sector, which is my main motivation for why I'm seeking this position on the APhA Board of Trustees. Throughout my career as a pharmacist and pharmacy manager, I witnessed firsthand the impact pharmacists have on patients, and I know that there are many issues that need to be resolved. I'm the only candidate this year from the chain pharmacy practice, and that voice needs to be heard. After this year, the current APhA Board of Trustee member that is from chain community pharmacy will be terming off, and there'll be no chain representation. That voice needs to be heard. There's over 155,000 chain pharmacists in practice, and every voice should be heard at the APhA Board of Trustees. I would bring to the APhA Board over 18 years of professional advocacy. I've dedicated my career to serving for association, APhA, including service on APhA committees, policy review, and policy reference, as well as currently serving on the APhA PAC Board of Governors. I'm also a past president of the Florida Pharmacy Association. Advocacy starts at the grassroots levels, no matter what role you serve. If you're a member or a professional leader, I love our profession, our association. Maybe my privilege and honor to have your vote to serve on the APhA Board of Trustees. Thank you.
Thank you, Scott. Appreciate it. So we're going to go into the next pairing for Board of Trustee at Large, pair 2, and we'll start with Ashley Lorenzen. Ashley?
Good morning or good afternoon. My name is Ashley Lorenzen. I'm so excited to be here to talk with you guys today. I currently live in Florence, Wisconsin, right next to the Upper Peninsula of Michigan. I am a federal pharmacist. I work for the VA, and I'm so honored to work for our veterans every day. Even though I work for the VA, and as some of you may know, the VA has a very broad global scope of practice, I feel like I am able to connect with lots of you that are on the call and just in general. During school, I worked both at chain retail, grocery store-based retail, and a teaching hospital. Did my residency in a community-based healthcare system. Worked at a level 1 trauma center right after school, worked in oncology, worked in metabolic support, took a teaching position with Concordia University School of Pharmacy, where I was the first ambulatory care pharmacist for Ascension, Wisconsin. And I also moonlighted at an independent pharmacy. I now, like I said, work for the VA, and I'm so honored to work with our veterans. I work in geriatric practice, hospital, hospice, palliative care, the older generations that have got us to where we are today. And I feel like we have so much to give back. So I feel like I would be able to connect with a lot of you guys on the call and at large today, and it would be my honor to have your vote. One thing that I would be so delighted to bring, and this is similar to what a couple of the other candidates said, is I really believe that we can't do great things unless we start with those little L's. So one of my biggest mentors said at one time, there's big L's, Ashley, and those are the leaders with the title, and then those little L's. Those little L's are the ones that lead from within. And I really think we need to get to the root of pharmacy and those of us that are on the front lines every day. And if as I believe it was Kelsey said, if we can really start at the ground and really get back to what pharmacy is and get back to self-care. I'm a mom as well. Get those names heard. I really feel like we're going to do amazing things in the future. I spoke at APhA annual on this, and I also spoke at my local association just last week on the value of retreats and really starting to grow our profession personally as well as professionally. So I'd be honored to continue to do that for you as a trustee at large. Thank you so much, Sandra.
Thank you, Ashley. All right, and we're going to go to Nellie Gazarian.
Thank you so much, and good afternoon, everyone, and a very, very good morning to those in Hawaii and Oregon. I mean, geez, guys, it's 8 a.m. So that's, again, I really appreciate you being here. I want to first off start by saying what a beautiful slate of candidates. I just want to congratulate my fellow candidates. As I was listening to everybody, we all want to do what really uplifts pharmacy. And I think you're in good hands. So that's first off, that's what I want to start. For me, particularly, worked in various different settings, moved around a lot. So when someone says, hey, are you from New York? Like, yes, I have. I'm actually raised there. And then I'm from Texas, and I'm from Florida, and I'm from North Dakota, and I'm from Georgia, and now I'm from Virginia. I just moved around a lot with different community settings. I've worked at Walmart, CVS, Walgreens. Worked at the hospital, and then finally transitioned as a pharmacist to the United States Public Health Service Commission Corps, where I serve at the Office of the Assistant Secretary for Health, and infectious disease are my jam. As you all know, we work on it's a very different role for me, particularly where I focus on public health in general, focus overall on dealing with stakeholders, working with a variety of provider groups. So I really think my particular niche and expertise will be, among other things, one big one that I'd like to focus on is really just take the pharmacist story and share it with others, share it with the patients, share it with our provider groups like our MDs and DOs. We understand that we're important, but just really open it up to them and say, we do more than lick, stick, and pour. But at the same time, the most important thing, I'm a mom of three. I can't believe Scott also has 3 kids. I don't know how you do it, Scott. I barely survived, but I'm a mom, and it's very important. Listening is very important. So active listening is my game, like Vibhuti said. I don't have a very great rhyming phrase, but if there's a problem that's more important to you, I want to hear that problem, and I want to uplift your voice on the board. So that's essentially what I would like to do. But hopefully I catch you up to speed. Back to you, Sandra.
Thank you, Nellie, very much. Well, thank you all of the candidates for your introduction. So now we're going to go to the Q&A session. For the first 2 rounds, we'll have attendees submit questions through the chat function or raise their hands. I'll select 3 questions, 1 for each candidate pair, and each candidate will have about a minute to answer their designated question. So we'll adjust depending on time to see how that goes. So we'll start with the president-elect candidates for the first question. And I do have questions coming in here, so let me pick one. All right, so the first question, we'll start with Vibhuti. And the question is, you will encounter diverse viewpoints and resistance to change within the organization. How have you handled similar situations in the past? And what strategies would you use to foster unity and drive consensus among different stakeholders? Vibhuti, I'll start with you for about a minute, and then I'll turn it over to Magali.
Thank you. So I think even not as president-elect, I think on the board and in leadership, we're always going to encounter diverse viewpoints. There's a lot of resistance, I think, to change because for many, it can be kind of shocking or jarring to sort of get the rug taken out of under their feet. I always get these wrong, but really thinking through perspective. So one of the things I pride myself on, known as like the word on the street. I intentionally surround myself with perspectives that are not limited to my own, and that people who think and talk like me or may have the similar perspectives as I do. It's really, really important for me to identify what's the common goal here. So not every situation needs consensus, for example. Not every situation will need unanimity. What we need is an understanding of perspectives. So what perspective do we carry? What perspectives are we missing and that are not in the room? How do we get those perspectives? And what are some of the assumptions that we need to challenge that we're working through in a conversation? And then the other thing I like to look at is any unintended consequences to be thinking through for our ideas and our actions. All of us have our own lens. We are going to have blind spots, and we're going to not catch everything. And so it's really important for me to understand different perspectives and make sure that we're actually getting people in whose voices can be heard and seen, not just on a token level, but actually thinking through consequences and challenging those assumptions. I think the other thing is that, as I said, I work with lots of different stakeholders. It's really, really important for me to provide an iterative process by which we can actually hold our ideas accountable and ourselves accountable. We don't lack vision in pharmacy, but I think the processes need to be in place for us to realize those ideas. So really thinking about perspectives and an iterative process to follow through with those ideas. We don't all need to agree, but if we can get consent in how to move forward, that we have confidence that as a group that we can move forward with this decision. And we need to actually hold ourselves accountable and think through things we might be missing. And I think that's going to be really important so we can go back and ask ourselves, should we find ourselves here again? What could we do differently? And really provide a QA, quality assurance lens to what we're doing in our decision making. It's a great question. Thank you.
Thank you for Beauty. I'm going to read it to you again, Magali, just so you have it, and then you can start. But again, you will encounter diverse viewpoints and resistance to change within organizations. How have you handled similar situations in the past? And what strategies would you use to foster unity and drive consensus among different stakeholders? Magali?
Yes, Sandra. As I reflect in this question, I think back on the 6 years that I've been on the board of APhA and how many times we have encountered situations where there are diverse point of views, where we again have to take into account so many stakeholders, not only internal to the organization, but outside, members, other pharmacy organizations, and how we bring unity and we bring consensus to that. And I think one of the things that is really critically important is to listen. I think it's very important to listen to diverse point of views. And while they may seem that they are counterpoints to a situation, many times it's getting to the why. Why do people have a difference of opinion? What is different? Where are they coming from? And trying to create a dialogue that is respectful. Many times what happens is that, change is difficult and we all are scared of change. But I think that really getting to listen to people, getting to listen and finding, like what Beauty was saying, those areas of consensus, but having what is the best outcome possible and having really the membership, the patients, and the profession ahead, I think that is very important. The same thing happens, at the local level. I remember vividly when I was the president of the Maryland Pharmacists Association, how many areas we needed to find consensus, not only among pharmacists, but also among other healthcare providers. How many fights we had, with physicians and other healthcare providers. And it's really always finding that commonality, what brings us together and what's the ultimate goal. So I think that, again, listening, respect, and valuing the other points of view is going to be very important to make informed decisions.
Great. Thank you, Magali. Appreciate that. So thank you to the presidential-elect candidates for their responses. We're going to move into the trustee candidates and have some questions for them. We'll start off with the first pair, and we have a great question here from Brian Gomez. He's from the University of Georgia College of Pharmacy, and he's part of the voting student delegation of the House of Delegates. So we'll start with his question, and then we'll start with, looking here, with Kelsey. So Kelsey, the question that I'm going to pose to you is this. I'm in support of the proposed bylaw changes, and I'm cautiously optimistic and hopeful that they'll pass. However, there is always a possibility that they will not. If the proposed changes are rejected, what would you take from that result, and what issues or strategic directions should the association prioritize and pursue in light of that result? So go ahead.
Thank you, Brian. That is a great question. And I think what we know that things need to be adjusted and changed. So we have incoming student pharmacists and new practitioners that expect something maybe a little bit different from their organizations than historically we have. And so we need to be able to meet those needs. What I envision, because I also have been thinking about this quite a lot, because I think the bylaw changes are extremely important, because even the fact that they exist, right? The fact that the conversations have been had and that this has been identified as a potential need means that even if they don't get passed, we can't just ignore that. Something has to be done. And so what I have been thinking about, just certain ideas, is that maybe we have more intentionality behind the breadcrumb trail that I talked about. So maybe there's more SIG meet and greets or intentional Zoom meetings about careers in diabetes or medication therapy management that are directed towards students and new practitioners, so that they can see themselves in these roles. Maybe there's always going to be a student liaison, or we suggest that there's a student liaison and a new practitioner liaison as a part of all of the current existing SIGs, just so that they get their voices heard, because we need to bring those voices into the room so that we can understand, as generations change, how we need to keep meeting our members where they're at, so that they feel like they have a home in APHA. And I think that just if these bylaws don't get passed this time, it doesn't mean that we set them aside. It means that maybe we revisit and we see, what did our membership like about the potential bylaw changes? What did they dislike? Because I know that there's been a lot of years of research and thought and intentionality into these suggested bylaw changes. And so there's a foundation there for these conversations, and that foundation might need to be a new shift for our organization. And that can be scary, but I think that that means that there's a lot of opportunity. And with opportunity comes a lot of fun conversations and bringing people into the room whose voices need to be heard. Thank you.
Thank you, Kelsey. All right, Scott. So do you need me to repeat the question, or do you feel comfortable answering?
I feel comfortable.
Great.
No,
All
I
right.
think Kelsey's brought up a great point. APHA is the home for all of pharmacy, and we as a professional association must do everything possible to make sure that we are welcoming and we are listening to our members. Students are a critical part of that membership because they will be pharmacists in just a couple of years. They are the future of our profession and our association. Without having that development, our association will cease to exist. So we have to do everything in our power to make sure, and I would just often add this. I first am not going to be the one to say I have solutions without listening to students first and the new practitioners. I would take the point that I would first listen to the new practitioners, see what's important to them, and because I don't know everything. I want to learn more and learn from their experiences. I know what it was like when I was a student, 10 years ago, 15 years ago, and that's changed. The profession's dramatically changed in the last decade. And I think it's important to be a leader, you have to listen first and then take those responses, come together as a group and collaborate on how we can move the profession forward. Great question.
Thank you. Thank you so much, Scott. All right, so we will go ahead and ask the same question of the second pairing. It's a great question, so we definitely want to hear what the others have to say. So if we can start, and we'll go in the same order, Ashley Lorenzen, if you could answer that same question.
Of course. Well, first of all, Brian, I just wanted to say thank you for being so engaged as a student. I think our organization starts with students, with those who are going to be pharmacists and work right along with us. I think if the bylaws don't pass, I think back to what my parents always tell me, sometimes you have to quote unquote fail to make things better. So listening to all of the input from all of the pharmacists, all of the students, all of the technicians, all of the industry workers, everyone that's a part of APHA that makes APHA what it is, we really have to listen to everyone. And that's where I talked about earlier about that big L and that little L. There is something to be said about those little L's, and they can make so much of a difference. It's unbelievable. We've got to start engaging our technicians, our students, our new practitioners, as well as the rest of the organization. And we've got to make sure that everyone's voice has been heard. So I think, if they don't pass, then we need to pause, we need to reflect, and we need to see what went well and what didn't well, and how we can move forward, and how we can engage everyone where they are. Pharmacy's hard, people are burnt out. I really want to work on, well-being, but to work on well-being, we have to make sure that, we have the time set aside. Just like any organization, if you're in an organization, you have to intentionally make the time. We've all talked about how a lot of us have children. It's hard. We have multiple things. So I wouldn't consider it necessarily a fail, but okay, let's reflect on what went well, what didn't go well. And let's start with those students. Let's start with those technicians. Let's start with those new practitioners. You know, I graduated school 12 years ago now. I feel like I'm ancient, but at the same time, you know, I have students in my practice. They come through regularly. I have residents come through. Getting that perspective of lots of different people is very, very important. So I think that's where we start and we, you know, kind of reflect and then move forward from there.
Thank you so much, Ashley. And we will pass it on to you, Nellie, to close us out.
Thank you. Thank you so much. And Brian, great question. I mean, like I said, I'm from Georgia too, so a little woohoo to Georgia. But you're similar to Ashley, kudos to you for being a part here and asking and staying engaged. I didn't have that opportunity in my school. Also, I had 2 kids while I was in school, so it's complicated, but kudos to you. So keep doing that firstly. The one thing I want to add is APhA is for every pharmacist, but it also says for all of pharmacy. And for all of pharmacy is beyond just a pharmacist. So I just want to highlight that. I know it's in there, so I think we're moving in the right direction. It is a part of bylaws. So just continuing to go down that path. I like to say that I was a student not too long ago, but now that I do the math, it was 9 years ago. So that's not working. But student pharmacists really shape the future of our profession. When we talk about infectious diseases or when we write strategies at the national level, we like to go a little bit more upstream and see what is it in that curriculum that they are learning that we know can change the practice of pharmacy. So I think it'll be very, very important to have student voices, new practitioner voices there. I mean, geez, I use students to tell me all the new fancy drugs that came on the market, right? So like you guys know what's happening in the market right now. And then looking at the analysis more in a scientific way, right? Like, so we know if it didn't pass, okay, what was the opposition? Why didn't we pass it? Is there some concerns that folks have? Does this need to be reworded? Are there some other things so I really think I want to hear from both sides of the tables, because both sides of the tables have voices. This is something that we do in state legislation, state policy, or state education, rather, I should say, when we educate our legislators to say, okay, what are your concerns? Can we address those concerns and can we still meet the needs? So again, thank you all. Active listening, I think collectively on the board, when we all put our heads together, there will be great solutions that come out, but keep raising your voice, keep asking these questions because they're important. Back to you, Sandra.
Great. Thank you so much, Nellie. Well, great responses for this first round of questions. What we're going to do now is go into a second round of questions, and we're going to start again with the president-elect candidates. We'll reverse the order of responses. So we'll start with Magali this time. And so I have a question here. I know we were seeing if anybody has their hand raised or if they wanted to ask anything, but I do have a question that was submitted here. Let's see. The question is, and I'll start again with you, Magali, and then we'll go to you, Vibhuti, for about a minute or so. How does the association support practitioners, employers, and payers to actively promote pharmacists and value-based arrangements? So I'll turn it over to you, Magali.
Yeah, as I hear you all talk about new practitioners and how long you've been in practice, I don't even want to tell you how long I've been in practice. So I was just reflecting on that. Yes, so Sandra, this is an area of a lot of interest to me, because that is, well, I have practiced in a variety of different practices, but the last couple of years I've been focusing a lot in value-based. I have various models in Maryland. Maryland is unique because we do have a special arrangement with CMS where the state has more controls, all right? We're under a total cost of care model. And so we've been really focusing in developing these value-based models and really figuring out where pharmacists fit within those models. So we have had a lot of experience in physician practices, in population health. And I think that APhA, well, we have done some educational programming on that. We have done some resource tools. This may be an area where, again, we should put a little bit more emphasis, because I do believe that healthcare is moving to this value base, is moving to performance metrics. And this is an area where sometimes I'm excited because we don't need to be a pharmacist provider to be able to bill for the services we provide, because it is a team, is that right? It's a performance base. So while we have done some work in here, I do think that maybe this is an area that we need to put more emphasis, bring more stakeholders together, make sure that we bring employers and many of these health plans that are really focusing in these values area, particularly CMS. This is a great area of interest for CMS. So I think that, again, providing opportunities for hearing those voices, forums, meetings, and developing resources and tool and highlighting experiences of pharmacists that are doing this and states where this is being done, I think it is important.
Thank you, Magali. All right, Vibhuti, I have the same question for you. Do you want me to repeat the question, or are you good to answer?
Yes, please. Thank you.
The question is, how does an association support practitioners, employers, and payers to actively promote pharmacists and value-based care arrangements?
Thank you. Yeah, and I concur that I think it's a growing area of need. I don't think it's new necessarily, but I do think that we are going to have to really think about how APhA convenes and unites our profession in one voice, and then take that united voice outside of our profession, so that they can become our advocates. I was thinking recently, I've worked with federally qualified health centers and independent pharmacies and getting them into partnerships and arrangements. And what's interesting is that there's a National Association of Community Health Centers, for example. It would be really amazing if we could build on work that APhA and CDC have done, for example, with the pharmacist blueprint and how to engage in CDTM, et cetera. There's a lot of great work that we have done, but I would love to see it built upon. And imagine if the National Association of Community Health Centers sent to every FQHC a blueprint about how pharmacists can be embedded in the clinic. Imagine that, right? Like, so that when you have the payment model, we can work on the legislation. Legislation takes time to implement. We have to have the workforce ready. But if we can get some outside of pharmacy advocates, so I think this is where the stakeholders come in. This is where the outside pharmacy organizations come in. We need to unite ourselves as a profession, take that voice outside so that they can become our advocates for us. My work is really rooted in health equity. And the one thing that I found is that we need engagement with several different stakeholders to ensure that our work is centered in health equity, so it doesn't become a separate thing. And this is the way in which we do that. Building a leadership pipeline so we can actually look at these workforce issues and show and demonstrate how we can bring value as pharmacists to these organizations with human-centered solution, and really watching other states, for example, Magali mentioned, and then other states also have the standard of care models where you have regulatory things that are getting out of the way so pharmacists can actually really get in there and do their work. So I think that partnering, uniting our voice and taking that voice outside of our profession so they become our advocates, it's going to be really important to demonstrate pharmacist value.
Thank you, Vibhuti. Thank you both again for great answers and great responses. And so we're going to go into the trustee pairs. We'll start with Scott for this next answer, and then Kelsey. And I saw Andrew had his hand up. I don't know, Andrew, if you had a question you wanted to read out loud. And if not, I do have a question.
Hi, Sandra. Hey, everyone. I actually did have a question, but based on how the candidates responded, Magali and Vibhuti, I think it answered it well. So no need to ask my question anymore.
Okay, all right, Andrew, thank you. So we're going to go ahead and ask you, Scott, the next question, and then we'll go to Kelsey. So the question is, what do you feel is the next step of growth for community pharmacy practice? And as a trustee, how would you help APhA facilitate that growth?
No, I love that question. It's something I take personal. I had a wise mentor once told me, when you don't succeed, just keep showing up. And I think that's been my mantra from day one. And I would encourage, we all need to show up, especially our chain community pharmacy colleagues. When I go to pharmacy meetings and I look at different tags of the different attendees, oftentimes I don't see many members from chain community pharmacy. And that's sad to me. That hurts me because that's a voice that needs to be heard. And I think one of my visions is seeking how we can improve and increase the membership, especially not just within chain pharmacy, but all of community pharmacy. That is a majority of the pharmacy practitioners that are out there in the workplace today. And that voice is woefully underrepresented, both in membership and leadership. And that's something that I would definitely strive to encourage and work to improve and hear what brings value to them. And I think we all know the value of APHA. We know in our heart, we have in our passion, but we each need to sit back and take a moment and just step back and say, what is the value of a professional association like APHA? There's so many things that APHA does each and every day that oftentimes we just take for granted. And we look back at the advocacy efforts and how we can work together to transform the profession. And what does that look like for our chain community pharmacy practitioners? And I feel like I've been able to collaborate with not only within community pharmacy chain, but outside of outside of that practice with my involvement as president of Florida Pharmacy Association, working alongside the table. And that's a perspective I would bring to the APHA board. Thank you.
Thank you, Scott. All right, Kelsey, I'll read the question also to you, and then you can go ahead. So what do you feel is the next step of growth for community pharmacy practice? And as a trustee, how would you help APHA facilitate that growth?
I think that's a great question. And I feel like the question is leading me to want to answer about our services and the payment model. But I think the next step of growth might be the mental well-being of our community-based pharmacists, right? If we're talking about people that are in community-based pharmacies, I think before we add on extra things, or as we add on extra things, we need to make sure that there's protected time, that the staffing is appropriate. Because I think one of the things I always worry about as an organization, that as we advance practice and we get all of these prescriptive authorities that we hope to get and the payment models to be changed for individuals who are in the community-based practice setting. When I was working for Walgreens and I would walk in and there would be 200 scripts printed and I would need to do MTMs and things like that. Those are real concerns. And so encouraging extra things to have to do, because I worked through the COVID pandemic. That was a big part of why I continued to work, is because I felt like it was essential. And it was challenging. It was hard to see and work with some of the pharmacy staff that were very burned out. And so I think what we can do is we can hopefully create resources and guides that are very tangible pieces. We can create things like the APHA immunization program, but maybe for advanced practice and for whatever billing models we come up with. We need to not just come up with, hey, now we can provide these services and get paid for them. That's great. We need to encourage people like how. So a lot of times maybe employers will feel more comfortable sending their pharmacists if there's a certificate attached to it. While they're working on the billing models. But so that way our pharmacists, we're starting to reinvest in our members as well as investing in the profession as itself. Because I think if we want more community-based pharmacists to get involved, they need to make sure that they feel like they're being heard and that their lived experience is being valued and being taken seriously, and not just promoting our profession because we know that we can do it, but just because we can do it doesn't mean that our pharmacists have the time potentially or the bandwidth. And so for me, that's going to be one of the biggest pieces that I bring to the table, is making sure that we're advocating and thinking about the mental health of our workforce as we move forward, because moving forward is absolutely essential and appropriate. We need to be practicing and continue to practice at the top of our license and get paid for those services. But we need to make sure we're doing so with our eyes open instead of closing our eyes to current workforce issues.
Appreciate that. All right, so we have one more question for trustee pair number 2, and then we're going to go ahead and go into closing statements after that. So I'm going to start with Nellie for this last question for the second trustee pair. And this question goes to the both of you, Nellie and Ashley. The question is, you both bring different federal pharmacy and personal experiences to the table. Tell me more about how you will use your unique experiences to shape the future of APHA. And so Nellie, I'll start with you.
Thank you so much. And Sandra, if I may take 10 seconds to add to the community pharmacy, because if you're going to be on the board, you wanted everyone's going to have a perspective. I just want to add 9 out of 10 folks in the United States live within 5 miles of a pharmacy. And we're able to say that statistic, and that's a huge statistic, because of community pharmacy. So I don't want to forget that. We serve the underserved in many, many states, right? So community pharmacists are everywhere. So we want to raise the voice of the community pharmacists. And lastly, the storytelling of community pharmacists. I really want to uplift the voices and say the stories. We might not always have the data, right? But there's something in there in storytelling. So I'm sorry, I just had to take 10 seconds to do that. And my next question was, we both bring different perspectives from the federal perspective. It's been a unique opportunity for me to learn. I've learned a lot in my current role where I did the underserved. What naturally I did was did hepatitis C treatments, right? It was like everyone was doing hepatitis C. And then I started to listen to the community and start to engage the community. And they said, well, you know, our issue is also syringe services. We find syringes in the park. So went and started to open a syringe service program. After that, we heard that moms are not getting prenatal care. So I started to go more into public health. After that, I got picked up to come to DC and write some national strategies to think through where do pharmacists play a huge role, right? So coming from that perspective where you're engaging community, which we pharmacists naturally already do, engaging variety of stakeholders like state health officials, we're talking to county health officials, we're talking to governors, we're talking to CMS. My particular role at Office of the Assistant Secretary, we're in HHS, so it falls under our umbrella is FDA, CMS, Indian Health Service, HRSA, which is where your FQHCs and everybody else sits, and SAMHSA, which is the Mental Health Service Administration. I work with these folks every day, and it's a great opportunity for us across the board in multiple different programs to show what pharmacists can do. APhA is another one where you did a lot of work with COVID with them. So we usually try to meet every quarter and think through how can we continue pharmacy engagement? What are you doing in your role? So CDC is another one as well, to give them a shout out here as well, because they do a lot of pilot projects to show how a pharmacist really, doing these innovative things, and can we then create a payer system for them? So we address a lot of these issues in my role I would say at a higher level to try and look at data all over the country. We're been fortunate enough to work with the APhA to look at state by state as well. So it's a very different perspective, and I feel like I've learned to see many different perspectives here. I think it would be a great way to share my experience and uplift the voice of pharmacy everywhere.
Great.
Ashley.
Thank you. And Ashley, do you need me to read the question to you?
Do you mind just one more time?
Oh, that's good. So here it is. So you both bring different federal pharmacy and personal experiences to the table. Tell me more about how you will use your unique experience to shape the future of APhA. Ashley.
Thank you. And Nellie, you stole my thunder. I was going to say something about community pharmacists as well. I just 10 seconds too, because I was going to do that anyways. But one of the things that I recently talked about when I presented at Pharmacy Society of Wisconsin last week was about burnout and about well-being. And I asked them, I said, how many of you work for a chain organization and you get a lunch, and do you really take that lunch, or do you get caught up? And there's a huge problem there because most people get caught up and don't actually take a lunch. So we need to start with our community partners and the bigger L's in those organizations to talk about what are the real appropriate staffing levels so that we can have less burnout and better well-being. So again, I didn't realize we were having separate questions, so I really wanted to say that. But so working for the VA, I'm truly blessed, and I'm truly honored to have the ability to do that. One thing that I really love about working with a VA is the broad scope of practice that we have and the integration into the entire healthcare team. So I know we're all familiar of statements from AMA and from different places about the pharmacists, but it's not like that in the VA. And why can't we spread that across pharmacy and earn and gain that trust? And why aren't pharmacists sitting at the table? I actually had a pharmacist meet me at APhA. And he said to me, and I know APhA is working on this, but he said, you know what would be really neat is if we had pharmacists, like a joint conference where we had a pharmacy association conference and a medical center or a medical association conference, like side by side, and we could go to different topics. And those things happen in the VA. I have a resident right now who her project is about women's wellness and making sure that we learn about the symptoms of post-menopause or during and after menopause, and making sure that we're talking about it, because in the VA, sometimes you think men, but there's so many women and it's so broad and we have multiple different perspectives, but we're at that table and we're working side by side with a physician and a nurse practitioner. And we're actually putting on a CE that the provider said, would you please do a CE for my medical providers that they can watch every year? And we need to do that nationally. We need to do that with all of our organizations, and APhA is trying, but I think we have a lot to learn from the VA. We have a lot to learn about where we're going and the importance. And I know that in the private sector, we have to focus so much on getting paid for our services. I don't bill in the VA, and my patients don't get billed for my care. And how can we really get that value broader without having to be so focused on cost, and work with our organizations to provide that, to get that trust and respect? Yes, we can still bill, and that's very important. Money obviously makes the world go round, but there's more to that than money, and there's that good quality care, and we have a lot to learn from the VA.
Thank you, Ashley. Well, thank you so much. I mean, these are some fantastic insights from our candidates today. So thank you all for providing engaging questions and answers. So before we wrap up, I'll give each candidate about a minute for closing remarks, and then we will conduct the reverse order for those introductions. So we have about a minute, and I just have a few closing statements after that. So we'll start with you, Magali, for your closing remarks.
Well, I want to thank everybody for being here today and for listening, and APhA for giving us the opportunity to really talk to our members. I think that where APhA is today, with the membership challenges that we're encountering with our strategic plan, and really the challenges that pharmacists facing today, I bring experience in leadership, as well as my experience as a practitioner. I think that it's important to really have that perspective and be somebody that is in the trenches and working and understanding what the challenges are. I want to assure that I continue to work to make sure that the voice of our members, all members, pharmacy technicians, student pharmacists, pharmacists in all settings, are really heard at the board table. One of the challenges that we have as an organization is member engagement. So I want to make sure that we continue to find ways to make our organization more organic, and that we allow the members' ideas of voices to be heard and implemented throughout the organization. One of the things that I keep saying is that my theme is claim our profession. I want to make sure that every colleague of mine and every student of mine feels the fulfillment and the passion and satisfaction that I have always felt doing my profession. It is so energizing for me to know that after all of these years, there's nothing that I love more than doing what I'm doing, and really being able to, in some way, in a small capacity, advance pharmacy practice. So I just want to make sure that you understand that I love challenges. I'm not afraid of challenges. Innovation, that's the space that I always be in, trying to advance the profession. And I, ask you to please contact me if you have questions, read the website, and I invite you to reach out to me and dialogue. And I really hope that I get your vote and your support, because we really are in critical times. And I think I bring a lot of experience to the organization. Thank you so much.
Thank you so much, Magali. The Beauty?
Thank you so much. I just want to also take a moment to say thank you to everybody who was able to join. I know this is for some of us morning, afternoon, in our work days. This is what we need. We need people to show up, right? We need people who have the time, space, and privilege to be able to engage with our profession. Our workforce is changing. We need to have tough conversations and couple that with some action. We need to be responsive. And what we're finding is we need to be responsive to the issues that are revealing themselves through the workforce research, for example, that our pharmacy profession is having. I encourage everybody to read our report on behalf of the team on the websites for the Pharmacy Workforce Center. There's a lot happening in our profession, and we really need systems changes. We need to be the convener that brings together our professional organizations so we can have a united front. And like I said, take that united front outside of our professions. We have to continue to advocate for personal and professional dignity. I would love for us to showcase our best and brightest so that the future workforce excited to join us. It would be nice to see our workforce go from outside the morning show studios for Pharmacist Month to being invited to the inside and have a dialogue and conversation where pharmacists are participating in that conversation. This also means that we need to challenge some assumptions that may be steeped in principles that may not apply today. We need to, like I said, think through unintended consequences and show up with social accountability. I'm prepared and ready to lead us to that culture of accountability that really helps us realize the vision that we have in pharmacy. And it's really important for us to invest in the resilience that we need so that we can show up with our best, unify that profession, and make sure that our future is where our students, our colleagues are thriving, not just surviving. They're optimistic and they're actually holding us to our commitments. So come join us. Thank you.
Thank you, Vibhuti. So we have about 3 minutes left for the next 4 individuals. I want to make sure I have time for the last couple of slides, and I don't want to make anybody late. So I'm going to please ask you if you can stay to like about half a minute for the next grouping. We'll start with you, Scott, and then Kelsey, and then we'll go to the next group. Scott?
Hey, no, thanks for having us today. I love this profession. As I mentioned before, I've been in the trenches for the first 16 years. Every single day, the 12-hour shifts, the no lunch breaks. Before it was cool, I've been there. My wife has worked in community pharmacy, RO practitioner years through COVID. I remember well being scared during the pandemic, but I knew that it was responsibility to take care of our patients. We saved our profession. We saved our population during COVID-19. Pharmacy did that, and I'm a proud participant to be able to do that every single day of my career. I feel like I would bring this board the perspective of not only having the 16 years experience every day serving as a frontline community pharmacist, but also in a role now where I can actually implement change and seek positive solutions to help support pharmacists and pharmacy workforce. Hope to have your support and vote. Thank you so much.
Thank you, Scott. Kelsey?
I am so grateful that you're here today. I'm so grateful to have been slated because I think that in itself speaks a lot about the voices that need to be on the board. And I appreciate your support and the consideration for your vote. But I know that our profession is in good hands because I truly believe in the mission and vision of APhA. And I hope to be a part of the conversations for the next 3 years. Thank you.
Thank you very much, Kelsey. Nellie?
I was just making sure, so I typed some stuff just in case people didn't have time because I know everyone has a 2 p.m. I typed some things again. Thank you so much. I will yield to Ashley if she wants to take the rest. You can read the chat.
Thank you, Nellie. And Ashley?
Thank you. I just want to echo what everyone said, and thank you for being here. I know we're close on time, and I can listen well, Sandra. So thank you for everyone for being here. No matter who you vote for, you guys are in good hands. This is a great group of people. I've had the pleasure of meeting each and every one of them at annual meeting, and wouldn't have made it through annual meeting without them. So the important thing is that you vote, and I appreciate your time in being here.
Thank you so much. Well, it's amazing. The candidates here, you are in good hands, but thank you again to all the candidates for taking the time to join us today. This event has provided valuable information for our members to consider while voting in this election. Again, additional information on each candidate can be found on the APhA's election website that will be linked in the chat now. You will find a full biography for each candidate and additional responses to questions. Speaking of voting, I urge each of you to act now by exercising your right to vote. The APhA election portal will be open until 11:59 Eastern Time on Monday, May 6th. And your vote is crucial in shaping the future of our association. Whether you're supporting one of the APhA slated candidates or wish to review the proposed changes to the APhA bylaws, your voice matters. APhA's election vendor, Survey and Ballot Systems, or SBS, has sent everyone their individualized voting emails Additionally, you may visit the My Account page on pharmacist.com or scan the QR code displayed on your screen to access the election portal and cast your vote immediately. Let's make our voices heard and ensure that our profession continues to thrive. Additionally, I invite you to spread the word and encourage your colleagues in the profession to participate in the voting process as eligible. Together, we can make a difference and chart a course for a brighter future for APhA. And if you have any questions on the voting process, please email elections@apha.org. I want to extend my heartfelt gratitude to all of our candidates for their participation in today's meet and greet event. Your dedication to our association and commitment to serving our professions are truly commendable. I also want to thank our attendees for their active engagement and thoughtful questions. Finally, thank you to the APhA staff for putting together this session. Lastly, do me a favor and please vote now. Thank you.